Welcome to the COVID-19 Q&A with Dr. Jan. If you have any COVID-19 related questions, feel free to pop it down in the comments box below and Dr. Jan will do her best to get to as many as she can today. G'day, Dr. Jan.
G'day, Andy.
So we had 233 locally acquired cases in the 24 hours to 8 p.m. last night. More than 47 of those were infectious in the community.
And I think that just really emphasises why we really do need to stay home. People can be infectious with COVID even before they get symptoms, and they need to leave their houses too. They need to go to the shop, they need to go to work. But the more time we spend outside of a house when we don't need to be there, the more likely we are to meet someone who has COVID, and the more likely they are to give it to us. So the safest thing you can do at the moment is stay home.
Definitely. Sophia's first in with the question today. She's asking about the Moderna and the Novavax.
Yep.
Will we be getting those anytime soon?
Look, they're both vaccines that the Australian government has purchase arrangements with. I'm not sure of their delivery date, but the key thing is we have an emergency here in Sydney right now. So anyone who's waiting for a vaccine, please go and get the AstraZeneca if you're over 18. Yes, there are some very, very specific medical conditions which might put you at slightly higher risk, but for the vast majority of people, whether you've got cancer, whether you've had a blood clot in the past, whether you're immunosuppressed, do not wait. Go and get the AstraZeneca now.
Yeah, definitely check the eligibility checker as well online. Sonia has a question about her second jab. She's worried that she can't get it in time. What do you do in this case?
So with the Pfizer vaccine, 3 to 6 weeks is the ideal amount of time. So even if you haven't got it 3 weeks, 6 weeks is good. And there's even some data coming out of the UK that 8 weeks is even still a good time to be getting it. So get it as soon as you can with the AstraZeneca. 4 to 12 weeks is the gap at the moment. And again, even if it's after 12 weeks, it's worth getting that second shot.
Question in from Lee. Lee's asking, can he give his Pfizer spot to an elderly parent and take the AstraZeneca in return?
Lee, that's incredibly generous of you, but what we'd really like is for you to get that Pfizer if you've got an appointment for it and have your parent have the AstraZeneca. The major reason is as we get older, the risks of having a terrible outcome from COVID go up, but also the risks of having that really rare side effect from AstraZeneca are right down. Whereas if you're in the middle, in Sydney at the moment, risk of AstraZeneca side effect low, but even risk in Sydney if you're a young person is higher. So if you've got a Pfizer spot and it's soon, use it for yourself, get your parent to have the AstraZeneca. And again, also if you don't have a Pfizer spot available to you and you're over 18, and you're in Sydney, talk to your GP because the risk of COVID at the moment outweighs any risks from AstraZeneca, and that includes the fact that COVID also causes clots. So if you've had clots in the past, unless it was due to antiphospholipid syndrome or heparin-induced thrombocytopenia, if you've had a clot in the past, you probably should be getting vaccinated and not wait for a clot from COVID.
Thanks for the question, Lee. Tiana's asking, how is there COVID in the community if everybody's wearing a mask? Is that saying that masks don't work?
No, masks work, but they're not perfect. So just like all the other things we do. So what happens is if you're wearing a mask, if you've got COVID, if the mask is on and you've got viral particles going out, if I've got my mask on, fewer viral particles go out and they certainly can't go as far. However, some can still escape. Same as if I'm wearing a mask to protect myself, viral particles less likely to come in when I breathe, but they can still come in around the edges, and so it reduces our risk of transmission, but it doesn't eliminate it. And at the moment, it's a bit like, why do we have a seatbelt with an airbag? It's because they both reduce our risk of injury. Getting vaccinated, wearing masks, staying home. They're all ways that we can reduce the risk of infection and reduce the risk of a poor outcome from infection.
Debbie's asking, is the AstraZeneca jab okay for breastfeeding?
Absolutely, Debbie, and it may even protect your child somewhat because you'll make the antibodies and you may pass some of those antibodies to your child. And since we don't have an immunisation for kids yet, it may be some of the best protection you can give your child. So, yep, absolutely fine with breastfeeding.
Thanks, Dr. Jan. Friends asking, our local testing centre only swabs noses and throats and not throats. Is this accurate?
Look, we'd prefer people to have both a nose and throat swab, but they may have a particular reason why they're only swabbing noses and not throats. If you're concerned about anything, do reach out to the clinic. You can see the name of who runs the clinic and you can approach that clinic to ask them the question. But generally speaking, yes, we prefer a nose and throat swab, but nose or throat is okay if you need to. It may be that they might have been running low on swabs towards the end of the day, and rather than using the same swab on 2 bits of you, they're just using it on your nose, because we have had lots of people getting tested.
Right. A question about active cases. Can you define what active cases are?
Look, active cases mean different things depending on which state or territory you are. Generally in New South Wales, you're active if after 14 days we take you off the active case list from the time of diagnosis. So it's just a period of time. Most people are non-infectious at the end of their active period, but we don't actually do a clearing test because a lot of people are non-infectious, but they still might have a bit of dead viral genetic material up the back of their throat. So we wind up with false positive tests. So it's much better to just make sure that somebody is completely symptom-free for 3 days, and that's when they stop being an active case.
Good to know. John has a question. He's asking, do antibodies produced in the mother from the vaccine also protect the baby once born?
Yeah, they do. It helps protect the baby. So again, being vaccinated and, the Royal Australasian College and New Zealand College of Obstetrician and Gynecologists now recommends that pregnant women take up the offer of the vaccine. So do talk to your GP, your midwife or your obstetrician about that.
Fantastic. Dr. Chan, could you explain the differences between the two vaccines at the moment, Pfizer and AstraZeneca?
Look, I think for most of us, the key things we want to know is what sort of protection do we get? And the answer is we get about 60% protection against any sort of symptomatic infection with the vaccines, but we get over 95% protection about being in hospital or dying from COVID from having the 2 doses of either of the vaccines and being a couple of weeks afterwards. So really good protection in the real world against Delta variant. And we know that, say in the US, for example, we know that out of all their deaths, less than 1 in 100 people who are dying have had the vaccine. So it's a really good protection, and I certainly feel a lot more comfortable knowing that my family's been vaccinated.
Get the first available if you can.
Absolutely. The best vaccine in Sydney at the moment is the first vaccine you can get your hands on.
Definitely. We've got a question from Nagina. She's asking, what are the side effects of the vaccine for a heart patient with, is it pulmonary? Pulmonary valve replacement.
A pulmonary valve replacement.
Yes.
Okay, that's a really good question. Look, for most people, the risks of having any side effect of the vaccine that will particularly impact that are much, much less than the risks of COVID. There are some people who the Australian cardiologists, so the specialist heart doctors who've worked with our immunisation professionals, say some groups of people might prefer to have AstraZeneca over Pfizer because in very, very rare cases, Pfizer can cause some inflammation of the heart muscle. So again, the first thing to do is to talk to your GP or to your heart specialist about which vaccine is right for you. But just remember that if you're in Greater Sydney at the moment, where we have COVID circulating in our community, for most people, the risk of having either vaccine is much, much less than the risk of catching COVID and the problems that could happen from that. And if you've had a pulmonary valve replacement or you've had pulmonary valve disease, again, you'd be at much higher risk of having complications from COVID. So please don't wait, get vaccinated as soon as you can.
Question in from Linda. Linda's asking, what's the evidence regarding whether heat kills COVID?
It would be nice to think that if we were having hot, sunny days that we would have no problems with COVID. Unfortunately, COVID is still around in summer. It doesn't like the hot as much as it likes the cold, and if you've put something through a full sterilisation dishwasher, for example, it kills viruses as much as anything else. But I wouldn't be relying on just sitting in the sun to get rid of COVID.
Yeah, definitely. What are some of the other things that we can do besides wearing a mask and washing our hands and sanitising to stay safe?
It's really about COVID likes it when we're with people. And because we're people, people love people, and COVID loves us loving people. And so every time we come together with each other, COVID COVID says, okay, I can jump now. And the more people we have that face-to-face time together, the more likely we are to spread COVID to more of the people we care about. So the biggest thing we can do is the hardest thing, which is to stay apart from the people that we care most about, to stay within our household, and when we're at work, to stay within the minimum number of colleagues we need to be with at any time. So you can see me here. I'm here with my colleagues here in the communications unit, and I work with some of my colleagues in public health response branch. You won't see me wandering up to see other people, which is what I used to do because I like seeing all the people I work with, but I'm sort of trying to keep to a smaller life even here at work, or if I can, I work from home. So I think it's those things that are really hard because they're the hard behavioural changes for us, because most of us feel safe when we're with people we know, but that's also when COVID feels safe. It just loves to keep transferring between people we know and care about.
Definitely. And Dr. Jan, do you have a crystal ball of when you think this will be over?
I wish. I was just seeing one of my colleagues, and look, we know that everyone's trying to do the right thing, and for those who aren't trying to do the right thing, most of us are pretty fed up with them, let's be honest. But the biggest way forward is for us to get vaccinated, and we have a safe, appropriate vaccine available to most people in Sydney within 3 to 5 days. If you've been waiting to see what happens, if you've been waiting because you wondered if COVID was going to be bad enough, COVID is bad enough. Young people are in ICU, older people are in ICU, people are being split for days on end. So please don't wait and hesitate, just get out there and get vaccinated.
We've got a couple of questions coming in on Facebook. Sherilyn's asking, can you safely have the COVID vaccine if you're going through some chemo treatment for cancer?
Absolutely. Yep. Just talk to your chemo nurse. They'll be able to tell you which day is the best day to book that COVID vaccination. But my husband, he's an oncology nurse, and some of his patients say, oh, my GP says I should get Pfizer. He says, don't wait for Pfizer. If you get COVID, you'll be really sad. So just get the first vaccine available to you at the moment.
Okay. Deborah's asking, do blood thinners work to combat the side effects of AstraZeneca?
Look, one of the problems with taking blood thinners, if you don't have a particular reason to take them, is that it can actually make bleeding and so on worse. So we're certainly not recommending that people take blood thinners. If we thought it was going to help, we'd be telling you, yes, please take some aspirin for 5 days before and 5 days after, but we don't. So that's why we're not telling people to go and do that.
Okay. Anita's asking, does vaccination impact people with lipoma?
Lipoma. A lipoma or lymphoma?
Lymphoma, sorry.
Lymphoma.
Yep.
Again, if you've got lymphoma, the best vaccine is the first vaccine you can get your hands on at the moment. Go and get vaccinated.
And our last question today is from Betty. She says, I have varicose veins.
Varicose veins?
Varicose veins. Is AstraZeneca vaccine good to have?
AstraZeneca vaccine is completely fine if you've got varicose veins. And for some of those people who've asked me about vaccination just now with chemotherapy or with lymphoma, just remember all the people in your household are also eligible for vaccination. Because you have got a significant medical illness and significant immunocompromise, the people who live with you in your house are also eligible for vaccination. So please don't delay. Make sure everyone gets vaccinated as soon as possible.
Well, thank you so much, Dr. Jan, and thank you for sending through your questions. If you have any more COVID-19 related questions, feel free to tune in same time tomorrow. But until then, stay safe.